donating blood is free. Sharing things on social media is free. Donating to different organizations and relief. Everybody must know somebody that's affected or some drive that's going on and can look through and find some old clothes. It's just going through it was heartbreaking yesterday. I was hugging a lady yesterday after we were talking to her, and she lost everything. She lost her business. She lost her home. She doesn't have much clothes. She has to be at work. She has to be at work because that's what's gonna pay the bills. But it's kind of hard to work with all that on your mind. And then I've seen people with chronic illnesses. A lady, her GMR was like 30, which is her blood sugar. It should be, I don't know, like 7 or 6 or 5, but it was 30, which is extremely high. And she takes insulin. Insulin is refrigerated. You put it in the fridge. But if you have no light or anything like that, what are you going to do? If I send you to Cornwall Regional Hospital, which I'm probably sure is flooded with people who are actually flooded, because I know there's sections with no roof and so on. It's just it's a tough scenario right now for a lot of people. We just have to do our part.